Thank you again for joining us for Kinstretch. Today's focus is going to be on the spine. I'm Steve Piper. I'm the chiropractor here at Monash Health Collective and the Kinstretch instructor. I'm here with Demelza Clay, who is a lifelong athlete. Most of her background is in skiing and in surfing. And so with surfing or skiing, obviously I see a lot of patients with back pain. Trying to do those things, trying to get into extension or turn through the hips when you're suffering from back pain. I mean, you know what that's like. Yeah.
Debilitating.
So debilitating is a good word. So today we're going to focus on spine for Kinstretch, or Kinstretch for spine. What you'll need is a nice heavy-duty textbook like this. This is Applied Calculus. This will help you with today's spine course. Not because it's applied calculus, but something about an inch thick. Textbook at home is the best.
I'm just so relieved you aren't going to make me read that.
There you go. You will also need some kind of band. Now there are bands that are full circle. You will see that any kind of band or even a long sleeve shirt can work for this kind of thing. You'll need a yoga block. This one is made of wood, so don't drop it, because that'll hurt your toes, and some kind of tennis ball or lacrosse ball. That's all the equipment you'll need for today. And you should have received the morning routine, and prior to every Kinstretch class, whether it's spine or anything else, make sure you go through the morning routine to understand what you're dealing with in terms of either you have a closing angle pinch or something sharp in your neck or your low back, or is it just stiff and tight, which is why this video works so well for the spine. So to start, we'll get you and Demelza in a quadruped position. So come down on your hands and knees. And the first thing we're going to do is just what's called linear motion of the spine. So we'll get to the rotational aspect, but for starters, we're just going to go with segmental movement of the spine. So to do this, we're going to put Demelza's head and chin underneath. So this is going to move her upper half of her back and neck into what's called flexion. And then we're going to get her to do a pelvic tilt the other way. So now her entire spine is in flexion. This is, by definition, you've heard this a lot. This is called cat-cow or cat-camel or whatever. Most of the errors I see in this position are moving up and down through the shoulder blades. You actually want the shoulder blades to stay perfectly still, and you only want to move through the spine. So now that she's tucked underneath and bowing the spine up to the ceiling, we're going to get her to keep this part still and use her pelvic rotation so that she uses just the lower half. You can see she's starting to go into extension. She's only going to be able to go so far with her pelvis before she goes back the other way. So let's go back the other way. And you're trying to move from end range flexion to end range extension. And you'll know you're doing it correctly because as you bring your pelvis into an anterior tilt or extension, you're only going to be able to get so far with your extension. Okay, so go back into flexion. Good. And there's a little bit of movement up through the shoulder blades here. We just want to keep that nice and still, and just the pelvis is moving. Once you have a good handle on movement of the lumbar spine, or the lower half of the spine, then you can move into extension of the upper half. So bring this down, and now she's going to flatten this out and then come up with the head and neck. And now she's in a C curve the opposite way. There are a couple things we're going to try to limit. How much shifting back and forth, how much of her shoulder blades is she using. But for all intents and purposes, every piece of the spine is now in a nice extended position. And then to go back into flexion, so bowing, she's going to leave her head and neck here, and she's going to start with her pelvis moving into flexion. She's only going to get so far, and then she's going to have to rotate underneath to get this upper half. Okay, so that is global flexion and extension of the spine. When you're at home, what I want you to imagine is when you move into extension, so we're going to get her to do extension again, but this time we're going to go segmentally. So imagine there's a point on your back where you're trying to make that a hinge point, and then I'm just going to walk my fingers up her back as she tries to do it in segmental movement into extension. Here is the C curve the other way, and she tried to do it one piece at a time. And then so if I go back into flexion, again, her head and neck are going to stay still, and she's going to start from the pelvis. One segment at a time. She's not going to push up through the shoulder blades. Good. Really bend underneath. Good. Again, flexion. And then we can do it again into extension. Without dropping through the shoulder blades. Good, so stay in extension. Now I know what you're saying at home. What if there's no one there to walk their fingers up my back doing segmental movement? Well, that is where your band is going to come in handy. By now, if you've done this at home, if you've done this flexion and extension back and forth, you're trying to do the segmental stuff, you should know where there's a sticky spot or a point that feels more stiff than anything else. That's when you would take your band and let's just say, for all intents and purposes, that point on Demel's is right here. With the band, she can hold it underneath her hand. And she's got the perfect shirt on so that it doesn't slip or slide up and down her back. But now with the band there, now she's got a biofeedback tool where she can focus just on this one spot. So come up and down through this one spot. Good, that's good there. And then down, that's good there. Do you see how much limited movement she has focusing on where the band is? Come up. Right there, good. And down, 10 reps of that. Up, down, 2, 3, 4, 5, 6, 7, and as she's doing this, imagine that this is the spot that you're suffering with that kind of dull, naggy, achy pain. You can segmentally focus on this spot. 8, 9, 10. Once you've done 10 reps, you can move the band to another location. So let's move this just a tiny bit higher. And again, depending on what you have, you got that? Don't let that snap in my face. Depending on what you have for shirt, you want to make sure this isn't just rolling up and down your back. So now we changed the position, so it's a little bit more challenging to segmentally flex this spot without anything else moving. So here she's going to just turn your head just underneath a bit. Good. And now flex and hinge this spot. And notice how she wants to get her shoulder blades involved a little bit. It's a little bit more challenging. She's going to 10 rep that out. 1, 2, slow it down. 3, 4. You can see as she comes into extension, she really has that control, but rounding up or flexing up is a bit more difficult. 6, 7, 8, 9, 10. Good. Okay, let's take this away. And just to make sure that that's working well, we'll do one more set of segmental flexion extension. So start in extension. Good. And then you're going to segmentally move up. And now the spots that you worked on in isolation, you should have better control of that. Good. So full flexion. Start with the pelvis. extend segmentally without dropping through the shoulder blades. I guess that's your homework. Good. One more time underneath, so flex underneath. Keep your shoulder blades level, only flex through the spine. Good, so that's number one. You can come back up into a kneeling position. So that, that is really flexion and extension of the spine without any extra weight on top of it. So that would be without doing your body weight. The next one we're gonna do is with your body weight on top of something where you can no longer use the band because the band would have to go the other way. This is where the textbook's gonna come in handy. And I would recommend putting a towel or a yoga mat on top of the book so that you're not feeling the hard edges of the book. Okay, so here I'm gonna place the book underneath the mat, and hopefully at home you can see that there's now a ledge. Okay, and we're gonna get Demelza to lay on her back with the lumbar spine just on the ledge, so below the level of the pelvis. And I'm just going to switch positions here. So where do you feel that?
I think I have the edge of the book just on the top of the sacrum.
So move, so just on the top of the sacrum, so the base of the pelvis is just above the sacrum, so you want to shift down a bit.
Okay. Now the edge of it's probably, yeah, like right in the middle of the lumbar.
Good. And it should feel awkward because it's jutting into the back. So we'll get you to cross your hands on top just so everyone can see. So now you can see where the edge of the book is pushing up into the middle of her back. And what this is going to allow her to do is have a biofeedback tool because her spine is sitting on the top of the book and the rest of the pelvis is sitting below the level of the book. So there's some space there. And what that's going to allow her to do is segmentally lift and lower her spine that's not attached to the book. Okay, so hands on top. So all I want you to concentrate on is where the edge of the book is. You're going to slowly pelvic tilt up and down. So pelvic tilt as if, there we go. So now you're level. Now she's contracted everything on top and she's level with the rest of the spine. Okay, so she's actually lifted her pelvis up to become level with the spine. Lower down. And she's only going to lower down until the pelvis touches the ground and the rest of the spine is on the book. And you should be able to feel the movement coming from that segmental spot, probably around the L2 or L3 spinous process. Is that right?
Yeah.
So kind of mid to lower back. Yeah. And the nice thing about doing this, so this is the equivalent of you using a band in a quadruped position. However, you've got body weight control now. And you should be able to see at home, she's only pelvic tilting to the very spot where hypothetically, if you had a little bit of pain or stiffness in your back, you could work that area. Okay, so now slide down towards your feet. And now you have a completely different segmental zone because remember that your spine is sitting elevated on the book and your pelvis is lower than the spine. So you're going to anterior tilt the pelvis up and down. Go ahead. And here you can see this half. This zone here is staying completely still. And the zone below the level of the textbook is lifting up and down. And as awkward as that feels, it should feel nice to get that movement in there.
It does feel nice, yeah, definitely.
So with same thing with the band, we did 10 reps. I don't know what you're on for reps, I wasn't counting.
I'm not a counter.
She's doing segmental movement, and what we can also introduce at this point is a bit of an isometric contraction. So put your hands on your chest again, just so everyone can see. So here, so she was just basically doing segmental movement. Now we can get into a bit of an isometric where she forcibly pushes her pelvis down, ramping up tension, push down 20% effort, pushing down 40%. It's like she's trying to shear that segmental spot with an isometric contraction. 60% effort, pushing down into the ground, 80% effort. She's gonna take a deep breath. She's gonna hold that breath. She's gonna push down as hard as she safely can. Push down. She's holding that for roughly a 10 count. She's holding her breath, isometric contraction. And then she's gonna completely deflate, lifting the pelvis up, bringing it level with the rest of the spine. She's gonna hold that 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Relax. And that is going to give her more range of motion because she's worked through an isometric contraction, focusing on the muscle rather than just joint space. So second round, you can shift. So let's get you to move up towards the head. So second round, different isometric segmental position. Go ahead and start to push the pelvis down, which shears the spine a little bit at the edge of the textbook, ramping up tension, 20% effort, 40% effort, 60%, 80%. Take that deep breath. Push down as hard as you safely can, holding your breath. Maximum safest effort. Breathe out, the tension comes down. She's going to pelvic tilt, bringing her spine level. Hold. And then slowly relax, going back into the segmental shear at the spine. And again, you're doing this for stiffness and tightness. Okay, you can, how's that? You okay?
Good.
Yeah, good. You can sit up for a sec. So that is what you need applied calculus for. Or any textbook, the height of the textbook will often dictate how shitty that feeling is going to be in terms of segmental movement. Now, let's say that it's not a joint stiffness problem. Let's say that it's a muscle tension problem. That is where the tennis ball or lacrosse ball is going to come in handy. And I think the best way to show this is if you lay on your side facing the wall. I can just demonstrate what we're going to do first, and then we'll get you to turn on your back. So with the muscle, her spine travels down the middle, and then she's got a nice, well-defined group of muscle tissue on either side. And this is often the culprit with the sort of the, I can't bend to the right, I can't turn to the right. It's often muscle tissue. If you think you're having a problem, go and see your trusted health professional if you can't solve it with a tennis ball and lacrosse ball. Okay, so what we're going to do, this is called isometric ramping. She's going to use the ball as a feedback tool on how to contract segmental muscle tissue, if that was even a thing. She's going to focus on one particular spot. So let's say she woke up this morning, the right side of her back is a little grumpy in terms of this muscle tissue being tense. Okay, so here's the spine, here's the base of the pelvis. This makes a nice V here where there's muscle tissue. So she's going to lay on her back with the ball in the muscle tissue, not on any bone, but in the muscle tissue. You can see where I've placed the ball. There's the spine, there's the pelvis, muscle tissue on the side, okay? So let's get you to turn onto your back carefully.
Here, let me do this so that you can demonstrate that.
There you go. That's better. PG rated. So spine, pelvis, she's gonna lay right on top of the ball, so go ahead and lay on your back. Put your legs flat. The first moment you turn onto that ball, it is not going to feel comfortable at all because you're not used to having something jammed into the tight and tender tissue in your back. You okay with that?
Yeah.
So first 20 seconds, you're just going to relax. With the second 20 seconds, what you're going to do is you're going to do an isometric contraction of your core, if we'll call it your core, where you're pushing the ball down into the ground. Start to ramp up. So take a deep breath in. Slowly start to push the ball down into the ground. This is the soft tissue therapy component. So this is like having your own chiropractor, massage therapist at home. Shouldn't be saying this, I'm losing money. Push down, and then you're ramping up. So 20% effort, 40% effort, 60% effort, 80%, flattening the ball into the ground. Take a deep breath. Maximum safest effort. She's going to push down. Maybe we'll just move your hand out of the way. Good. You can see the ball there. She's trying to push that into the ground. And then as you release that tension, you can take another breath in, and now you're going to try to arch up over the ball. So this is you contracting muscle tissue to bring your back into an arch. And again, the ball is giving feedback where most of the contraction is occurring. Hold that for a 10 count. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Relax. And on the second round of isometric ramping, you should have far better control of how much dialing up the contraction you have, because now the ball's been sitting in there for roughly a minute. Your control is going to be improved. So this time, segmentally try to contract the muscle rather than the whole spine contracting. Just contract on the very peak of where the ball is. Start to push the ball into the ground again. 20%, 40%, 60%, 80%. Take a deep breath. Maximum safest contraction. You're pushing down into the ball. That is the soft tissue therapy component. And then release the tension. Take another breath in. Arch up, contracting muscle directly above the ball. Hold. And then slowly relax. Now the nice part about this exercise is you can place that ball anywhere along the spine and get the same result. So it'll get you to turn onto your side. Let's say she's got this, oh no, she's got the old rib out sensation. People always talk about rib dysfunction or rib out. You can gently place the ball. Now don't mash tissue too hard that's above the rib, because that will be very painful. You're placing the ball on the muscle tissue. You okay with that?
It's way less comfortable than the first position, but I'm good.
Why is it way less comfortable than the first position? Because there's less muscle tissue, more bone there. Remember I said place it on muscle tissue, not bone. So don't place it directly on the rib. That will suck.
It's nice. I'm good.
First 20 seconds, you start to accommodate. You should be okay. Okay, so now she's got a bigger problem in the fact that the rib cage isn't going to allow too much movement. Try to contract, flattening the ball within tolerance. Push down 20% effort, 40% effort, 60%, 80%. Take a deep breath. Maximum, safest, and tolerable effort. Breathe out. And then she's going to try to segmentally extend off the ball. Hold. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Relax. Second round. More segmental control. Push down 20%, 40%, 60%. Now I know what you're saying. If I'm getting a tingling traveling down into my big toe, well, that's probably because you're sitting on a nerve. Move the ball. 80%. Take a deep breath. Maximum, safest, and tolerable effort. Push down. And then let the tension go. Try to segmentally move above the ball. Hold that. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Relax. You can come up off the ball, come back up into a kneeling position. So all of that, whether it was global flexion and extension of the spine in the quadruped position, or the segmental movement with the band, or the textbook, was more designed for joint space. The second half, where we talked about using the ball as a biofeedback tool, more for muscle tissue contraction rather than joint space. And that is all linear movement to the spine. And what we'll do now is we'll move onto the wall. And here you'll see a little bit more linear stuff, but more importantly, you start to get into rotation of the spine. And that will be important for those people who need to understand the separation between the upper and lower half. So we'll call it the upper zone, the lower zone, rotational movement. So let's switch to the wall. Okay, so we've moved on to the wall. We'll just finish off the linear stuff. The reason why I want to give you this extra linear, the work on the spine, in case you're at work and you can't, I mean, you could lay on the ground, but you might get some questions. So this way, what we finished off with isometric ramping, but prior to that, we were using the textbook as a way of separating out between the upper zone and the lower zone, or the upper back, lower back. The same can be done against the wall using a block. And again, if you're using a wood block like this, made out of chopsticks, be careful you don't drop it on your feet. So here, we're going to place the block against the wall. Demelza is going to hold that block with her spine, body weighted pressure, and then we'll just get you to cross your arms in front. So now you should be able to see the block is sitting at a certain level of her spine, and she can hold that, don't drop it, right? So now, so you can see her lower half is against the wall. She can use the block as a dividing line between the upper zone and lower zone. And here she's just going to start to segmentally, so that's the end range, that's extension. She's going to segmentally come forward, bringing her hip off the wall until she feels the block. Notice her upper half, although I'm holding her there so that she doesn't drop the block, hasn't moved at all. So just the lower half go back. She's curving underneath the block and then forward. And same as before, there really is no ideal rep count. It's whatever makes your back feel less stiff. But I like 10 as just a guide. 3. The real rep count would be till the cows come home or you don't have back pain. But since we don't have that much time in the day, and here she's trying to keep her upper body still as her lower half flexes and extends underneath. Okay, so remember, this is linear movement of the spine. Don't drop that block. Good. So that's the lower zone. Now the nice part about doing that is that she can hold this position steady, and now she can start to do the upper zone only to the level of the block. So here she can flex and extend right where the block is. She's getting segmental movement, but not below. So let's say that you're really stiff. You can't move through there because that's painful. You can always block out that segment and move above and below it. Lots of different uses for that. So that's more linear, segmental flexion and extension using the block against the wall. This is the same idea as using a textbook along the ground. So we'll just take that out of there. And so now we'll go into more rotational stuff. So I'll get you to bring your feet directly against the wall. Good. Yeah, and the same thing, cross your arms. So with rotational movement, here we're going to find out exactly where she can flex to. Okay, so she's going to flex off the wall. Good. And if you have to step off the wall, if you've gone too far. Okay, so here she's got, you should be able to see this at home. She's got a nice round curve until she gets to about here, which is flat. So we'll get her to back up just a tiny bit, and we'll get her to try to keep her low back pinned against the wall as much as possible. So there's her global flexion again. You had a chance to see that in the quadruped position. So now that she's at this end range position, now we can do some rotational stuff. So I'm going to get you to pin that area. Don't let it move off the wall. And here she's going to turn to her right. So that is rotation of the spine. She's going to hold her right shoulder against the wall. You'll see it when she comes around to the left. She's going to hold that. She's going to pin. She's going to push back into the wall, creating an isometric contraction in her paraspinals. Good, and then she's going to flex down, rotating around. So go ahead and rotate around to the other side. And now you can see she's trying to pin that shoulder against the wall without her lower half extending off the wall. She's going to push into the wall, ramping up an isometric contraction. And then she's going to flex forward, coming again, rotating again with a little bit more space. So come and rotate off the wall. Good. Turning. Oh, stay there. Turn into the wall. Did you see her hips move there? You want to try to keep the hips perfectly still against the wall, as if something's pushing against you, and then you're pushing back. So that's rotational movement. And we'll get you to come around to the left side again. So flex forward, turning, rotating through the lumbar spine, push back against the wall. When you're doing your push against the wall, you're ramping up tension, just like we've been doing with the effort of 20%, 40%, and so on. Good, and then we'll get you to come forward again, so into flexion, and then up against the wall. And the nice part about that is you can change position. So let's say you wanted to focus a little bit more on the mid-back. You could bring your feet away from the wall, so now you're kind of sitting on the wall. And now this part of the spine, higher up on the spine, is touching. So now you can flex forward, just rolling onto that one spot right there. So that's a little different position. And instead of doing rotation this time, now we're going to get her to laterally flex or bend to the side, keeping that flexed posture off the wall. So she's just trying to squeeze her shoulder down to her hip in a flexed position. Okay? And then she can come back up in a flexed position and then rotate down the other side, holding that. She's trying to C-curve to the side, holding that position, and then come back the other way. Again, you're ramping up tension, 20% effort, 40% effort, 60% effort, 80%, and then your maximum safest effort. This is the progressive angle, and the regressive angle would be on the other side as she pulls her back the other way, pulls herself back the other way. Great, so she's done rotation and lateral flexion of the spine. Now, once you've done both of those, you can roll them into one controlled articular rotation. So let's get you to bring your feet back up against the wall. So now she's going to combine all four movements. So flexion, go ahead. Flex down as far as you can. And here she's going to rotate and then laterally bend as a way of getting more space as a rotation and lateral bend through the spine. And then she's going to come back, laterally bend the other way, rotate, and then come through that flexion. Again, rotating all the way, lateral bend, good. And then up to the other side, lateral bend, rotate, and then come all the way through again. Notice this movement on the wall is a lot more rotation and lateral bending than we did on the ground. Good. So that's number one. Number two is to turn to your left. So turn your whole body to your left so that your left side's against the wall. And again, all the wall is doing is acting as a biofeedback tool where you forcibly can't push that way. So now in the same light, cross your hands across your chest. Move yourself right up against the wall with your left leg as well. Right. There you go. No, left. You mean correct. So here, now she can laterally C-curve off the wall, and the wall is going to block her hip out, making sure that she doesn't get extra space from her hip because we want it from the lumbar spine. Okay, so she's laterally bent here, and she can squeeze down towards the ground. That's her isometric. Squeeze down 20% effort, 40%. You can push your hip into the wall. If the wall moves, you need a better wall. 60%, 80%. Deep breath. Squeezing down as hard as you safely can. And then come back up. Good. Okay, so second round, go a little bit further, come down into end range space. Good. And then start your isometric again. 20%, 40%, 60%, you're trying to squeeze down in that end range space. 80%, you're fighting for joint space. And then come back up. As you turn around the other side. And this will be a really nice view as you can see her spine, and you'll see where it C-curves nicely versus where there's stiffness. So go ahead and laterally bend to your right. Good, look at this nice C-curve. And it stops right probably where she's stiffest the most. Is that right? Yeah. Start to drive down into the ground. Good. Ramping up tension. Within tolerance, if you're dealing with sharp pain, don't push into sharp pain. Come back up. Take a bit of a breather, so you're just relaxing the tension. And on the second round, you're going to go back into that end space. And notice now she's got a little bit more movement there. Hopefully you got the chance to see that. And she's just doing an isometric contraction, trying to laterally contract all of this stuff, changing this angle. Good, and then come back up. So that's lateral position of the spine, and the last one we'll do is extension with rotation. So here we'll get Demelza to face the wall. Just hands at your side, that's probably easiest. Okay, and go right up to where your toes will touch the wall. Good. And so now the wall is going to act for another biofeedback tool for her hips, not being able to come into extension through the hips. So she's just going to lean back as far as she can without falling off the wall. If you fall off the wall, that is not good. That's not good advertising. Okay, so here she's extending through the spine. And once she's found that maximal extension, she can start to turn herself as if she's turning back to the right, and she's going to hold that. 10 count, 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. She's going to turn over to the left, staying in extension. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. You okay with that? Yeah. Come back to the right. This is really hard to really work in her paraspinals. Trying to extend off the wall. 10, 9, 8. And as she rotates, 7, 6. The wall blocks out her hip. 5, 4, 3, 2, 1. Come back the other way. Again, trying to turn through the lumbar spine. Her hip is being blocked out by the wall. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Come back up, standing straight. Come back up, good. And just like we did when she had her back to the wall, now she can combine rotation, lateral movement, and extension this way. So here we'll start with her laterally bending. So go ahead and bend to the right. And then she's going to come back in rotation. She's going to rotate over the spine. So controlled articular rotation of the spine. She rotates to the left and then comes back up, bend to the right, extend to the right. So turn back this way. Good. And then rotate through. There we go. Good. I have to get my lefts and rights in order here so she can understand what I'm actually talking about. Okay, so let's go the other way now. So bend left, extend left, and then turn into rotation of the right, bend to the right, come up and around. Go ahead, one more lap. Good. And then extend. Good. And you're creating that extension point where the hips are blocked out of the wall. And in most cases, it's where you're going to have the most stiffness in your spine. You can come off the wall. So that is Kinstretch for the spine. Did you? You're okay?
That was good.
Good. I think between the ground and the wall, that is a great place for you to start in terms of building some tolerance and resilience in movement of the spine, something that all skiers and surfers probably could use. A little extra movement in there. Any other questions, get in touch with me, Steve Piper. I'm at Monashi Health Collective, but that is Kinstretch for the spine, and I hope that helps. Thank you.